Now we will discuss about vas deferens. Vas deferens are thick walled muscular tubes. They are connecting the epididymis to the ejaculatory duct. Is it? Actually, they are transporting the sperms from the epididymis to the ejaculatory duct. It is around 45 centimeters length. Then we will see course and relations of ductus deferens. See here, it begins at the lower pole of the testis as a continuation of tail of epididymis. Then it ascends upwards behind the testis and medial to the epididymis. Then it ascends upwards and reaches to the spermatic cord. This is the site of vasectomy operation. That means here only vasectomy will be doing. Then it ascends upwards and reaches to the superficial inguinal ring, then passes through the inguinal canal and reaches to the deep inguinal ring. Right? At the deep inguinal ring, it hooks around this artery. What is this artery? Inferior epigastric artery. Right? So it hooks around the inferior epigastric artery, runs backwards and medially. See here, it is running backwards and medially. Then it enters into the pelvic cavity. After crossing the external iliac vessels, it enters into the lesser pelvis. After that, it runs downwards and backwards on the lateral wall of the pelvis. Here, it crossing the obliterated umbilical artery and obturator vessels. Then, it crosses above and medial to the, what is this structure? Ureter. After crossing the ureter, it makes angular bend directed downwards and medially and reaches to the posterior aspect of the urinary bladder and reaches to the base of prostate gland. Here, it will be present medial to the seminal vesicles. Right? Here, it will united with duct of seminal vesicles and forms ejaculatory duct and enters into the prostate gland, then opens into prostatic urethra. So, this is the course of vas deferens. Clear? Recollect once again. Vas deferens is continuation of tail of epididymis. It begins at the lower part of testis. It ascends upwards behind the testis and medial to the epididymis. Then it enters into the spermatic cord. Right? Then it passes through the superficial inguinal ring, then inguinal canal, then deep inguinal ring. Right? After that, it hooks around the inferior epigastric artery, then runs downwards and backwards. Right? Where it crosses the external iliac vessels. Right? After that, it will enter into the lesser pelvis. Then it crosses obliterated umbilical artery and obturator vessels in the lateral wall of the pelvis. Then it crosses the ureter. After crossing the ureter, it makes abrupt bend or angular bend directed downwards and medially. Right? Then it runs behind the urinary bladder and reaches to the base of prostate gland, where it is present medial to the seminal vesicles. Actually, at the terminal part, vas deferens is sacculated, probably for the storage of sperms. Then, after uniting with duct of seminal vesicles, it becomes ejaculatory duct and opens into prostatic urethra. Right? So, this is course and relations. Now, we will see blood supply. Artery to the ductus deferens. Branches from the superior vesicle artery, inferior vesicle artery, right? So, these branches will be supplying to the vas deferens. Then, veins from the vas deferens united with vesicular plexus. Finally, they drains into internal iliac veins. Then, nerve supply. Nerve supply is by parasympathetic nerves through the pelvic splanchnic nerves. The main applied aspect in the vas deferens is vasectomy operation. That means cutting and ligation of vas deferens. Usually, here we will cut the vas deferens and we will ligate the vas deferens. It is very simple operation we can do under local anesthesia. We have to make median incision just below the penis so that we can get both vas deferences. Then we have to cut part of the vas deferens and we have to ligate. Right? So this operation is vasectomy operation. Actually this is reversible operation. If you require, you can recanalize again. Even though we cut the vas deferens, sperms will be going on producing, but those sperms will be degenerated and phagocytosed. But testis will be keep producing the testosterone to maintain the male characteristic features. After vasectomy, even though there is no any communication between the testis and vas deferens, still ejaculated semen contains sperms up to 2 to 3 months in the process of emptying. right? So this is about vas deferens.